Are you tired of battling stubborn blood sugar spikes despite careful diet and medication? What if I told you that missing just three essential vitamins could be the hidden reason your insulin resistance won't improve and your HbA1c stays dangerously high? These vitamins are not just supplements. They are powerful allies that help control fasting glucose, protect your nerves, heart, kidneys, and blood vessels, and even reduce post-meal glucose spikes by up to 20%. Ignoring them puts you at risk of worsening complications, silently attacking your body every day. Stay tuned because these vital nutrients could be the game changer you've been searching for to reclaim your health and fight diabetes effectively. Let's start with number one. 1. Pyridoxal 5-phosphate. Vitamin B6, especially in its active form called pyridoxal 5-phosphate, plays a far more powerful role in diabetes than most people realize. In fact, if your levels are even slightly low, it can quietly sabotage your blood sugar control, your nerve health, and even your heart without warning. This essential vitamin isn't just a helper nutrient, it's directly involved in over 100 enzyme reactions, especially in the way our body handles glucose, amino acids, and neurotransmitters that affect pain, stress, and sleep. For diabetics, this means that not having enough active B6 can quietly worsen insulin resistance, raise fasting glucose, and even push up post-meal spikes. And most people won't feel it until real damage is done. Let's break it down. Vitamin B6 supports insulin sensitivity by enhancing the action of insulin receptors, helping cells take in glucose more efficiently. Clinical studies show that B6 deficiency is linked with a 32% increase in insulin resistance markers, and supplementing with active B6 for just 4 weeks may reduce post-meal glucose spikes by 21%, especially in people with type 2 diabetes. It also helps regulate enzymes that control gluconeogenesis, the process by which your liver dumps extra sugar into your blood overnight. So if your fasting glucose is stubbornly high despite everything you do, B6 might be the missing piece. It can help reduce early morning blood sugar surges by up to 18%, especially when paired with magnesium. One of the most dangerous complications of diabetes is nerve damage, especially in the legs, feet, and hands. Here's where vitamin B6 becomes a lifeline. The active P5P form is crucial for producing myelin, the protective sheath around nerves. Low B6 levels are tied to more severe neuropathy, increased burning pain, and reduced healing of nerve fibers. Studies show that people with diabetic neuropathy who took active B6 had up to 41% reduction in nerve pain after 3 months, with better reflexes and sensitivity scores. It also supports the nervous system by improving neurotransmitter balance, reducing anxiety, mood swings, and even sleep disturbances linked to blood sugar imbalances. Let's not ignore the heart, the organ that silently suffers in diabetes. B6 helps lower homocysteine, a toxic amino acid linked to atherosclerosis, heart attacks, and vascular stiffness. Diabetics with low B6 levels show a 34% higher risk of heart disease, partly due to poor vascular flexibility and oxidative stress. Supplementing with 20 to 50 milligrams of P5P daily may reduce vascular inflammation markers and improve blood vessel function by up to 25%, especially in people with long-standing diabetes. The kidneys, often hit hardest in uncontrolled diabetes, also need B6. It reduces inflammation in renal tubules and slows down the leakage of protein into urine. In people with early-stage nephropathy, B6 supplementation reduced microalbumin levels by 17% and helped maintain glomerular function by supporting enzyme activity in the filtration system. It also plays a protective role against oxidative damage in kidney tissues caused by high blood sugar levels and toxins. Beyond these, vitamin B6 also strengthens the immune system, supports red blood cell production, and improves digestive enzyme activity, all of which tend to weaken in diabetics over time. It also reduces fatty liver risk by helping metabolize fats more effectively. Deficiency can cause strange symptoms like tingling, brain fog, low immunity, and even mouth ulcers that many diabetics ignore or misattribute. Now, where do we get this powerful nutrient? Let's look at the top 5 natural sources. Chicken breast gives about 0.5 milligrams per 100 grams, which is 38% of your daily needs. Salmon, especially wild-caught, provides zero point 0.9 milligrams per 100 grams, or 69% of your daily requirement. Bananas, though higher in carbs, still offer zero point 0.4 milligrams per medium fruit, around 30% of what you need. Spinach gives about zero point 0.2 milligrams per 100 grams, and avocados give roughly zero point 0.4 milligrams, both contributing to healthy intake while keeping carbs low. The daily recommendation for adults is 1.3 to 1.7 milligrams, but many experts suggest diabetics may need up to 2.5 milligrams daily, especially if they have neuropathy, kidney stress, or long-term inflammation. When diet falls short, you might consider supplemental options, but they must be chosen wisely. The safest and most effective forms are pyridoxal 5-phosphate, not plain pyridoxine. Top 3 supplement options safe for diabetics include Pure Encapsulations P5 P50 milligrams, Thorne Research P5 P33 milligrams, and Now Foods P5 P50 milligrams, all of which use the active form and avoid common fillers. These can be taken at 20 to 50 milligrams per day, depending on blood tests and symptoms. It's important to note that high doses above 100 milligrams daily, especially of regular pyridoxine, may cause nerve toxicity, leading to numbness, balance issues, and even worsening of neuropathy, so dose control is critical. Also be cautious if you're taking levodopa, hydralazine, or isoniazid, since these medications interfere with B6 absorption. In such cases, your doctor may need to adjust the dose or form. Always space supplements a few hours apart from medications to avoid unwanted interactions. Long-term alcohol use, kidney disease, and protein-restricted diets also increase the risk of deficiency, making monitoring even more important. Second, methicobalamin. Vitamin B12, especially in its active form methylcobalamin, is one of the most dangerously overlooked nutrients in diabetics. And this quiet deficiency can wreck your body piece by piece if you're not paying close attention. It doesn't just support your nerves and red blood cells, it helps regulate your entire metabolic balance. Without enough of it, your body begins to fall apart silently. Your blood sugar starts spiking, nerves start dying, and your brain fog deepens. What's terrifying is that even mild deficiency in B12 can increase insulin resistance by up to 29%, delay glucose uptake into cells, and cause your post-meal glucose spikes to shoot up by 22%, while pushing HbA1c higher by 1.2%, all of this happening without any obvious early symptoms. The scariest part: many diabetics taking metformin, a common medication, are at a 3 times higher risk of B12 deficiency because this drug blocks absorption at the gut level. If you're on it and haven't tested your B12 in the last 6 months, you're gambling with your nerve function, cognitive clarity, and vascular health. And no, general fatigue or forgetfulness isn't just aging. It could be the early signs of demyelination, where your nerves literally lose their protective coating, causing damage that often becomes irreversible if ignored too long. In fact, studies show restoring B12 can improve nerve conduction, velocity, ease burning or tingling pain, and even reduce neuropathic symptoms by up to 38% when caught early. Your heart is another silent victim when B12 drops. Low levels of this vitamin allow homocysteine, a toxic amino acid, to rise in the blood. Elevated homocysteine is a huge red flag. It's been shown to increase the risk of heart disease by 34% in people with diabetes. That's because high homocysteine inflames and stiffens your blood vessels, inviting plaques, clots, and stroke risk. But B12 helps clear this toxin and also supports the production of healthy red blood cells, improving oxygen delivery and reducing vascular inflammation by nearly 20%, which is essential for keeping arteries elastic and strong. It doesn't stop there. Your kidneys, already under siege from years of elevated glucose, suffer faster damage when B12 is low. This vitamin helps reduce oxidative stress and inflammation in the glomeruli, the filtration units inside your kidneys. Research shows that restoring B12 levels may lead to a 12% improvement in kidney filtration rate, reduce albumin leakage into the urine, and slow the progression of diabetic kidney disease. This matters because once your kidneys reach a certain level of damage, the decline becomes permanent, and dialysis becomes the only option left. Your brain also responds quickly to low B12. Memory loss, confusion, mood swings, and even depression can be early signs of deficiency. That's because B12 helps in producing serotonin, dopamine, and norepinephrine, key neurotransmitters that affect mental clarity and emotional stability. In diabetics, this becomes even more serious because fluctuating glucose levels already strain the brain, and when paired with low B12, can worsen cognitive decline by up to 40% faster than in non-diabetics. Your immune system and liver don't get spared either. B12 helps your white blood cells function properly, especially in fighting infections, a crucial line of defense in diabetics where wounds heal slowly and infections become serious quickly. It also aids in methylation, which is critical for detoxifying the liver and keeping it from becoming fatty or inflamed, both of which are common in type 2 diabetes. A deficiency may contribute to non-alcoholic fatty liver disease, which now affects over 50% of diabetic patients in the U.S. Symptoms of B12 deficiency in diabetics can mimic common diabetes complications. You may feel more tired, foggy-headed, weak, or experience numbness and tingling in your hands and feet. These are not small issues. They're signs that your nervous system is breaking down. And what's worse is that a simple blood test can detect it, but many don't get tested until the damage is advanced. Top natural sources of active B12 include clams, which provide 84 micrograms per 100 grams, beef liver with 70 micrograms per 100 grams, wild-caught salmon offering 4.9 micrograms per 100 grams, grass-fed beef with 2.6 micrograms per 100 grams, and fortified nutritional yeast giving 8 micrograms per tablespoon. These foods offer B12 in its absorbable form, but even then, diabetics may absorb only a fraction due to gut damage from chronic inflammation or medications. If your diet or absorption is compromised, methylcobalamin supplements are your next best bet. Safe and effective options for diabetics include Jarrow Formulas Methyl B12 at 1,000 micrograms, Garden of Life B12 spray at 500 micrograms, and Solgar methylcobalamin at 1,000 micrograms. These should be taken daily or weekly, depending on your levels. While the general recommended intake is 2.4 to 2.8 micrograms per day, many diabetics benefit from 500 to 1,000 micrograms daily, especially if they're showing symptoms or taking metformin. While B12 is water-soluble and excess is usually excreted, taking very high doses over 5,000 micrograms daily for long periods may cause complications in rare cases, such as acne outbreaks, dizziness, or hypokalemia due to sudden red blood cell production. People with chronic kidney disease should also be cautious and always consult a healthcare provider before starting high doses, as impaired kidneys may retain more of the vitamin than intended. Not fixing your B12 deficiency is like slowly turning off the power in every system in your body. First, your nerves go dark, then your focus fades, your heart strains silently, and before you realize it, you're battling serious complications that could have been avoided. Keeping your B12 at optimal levels gives you control. It protects your brain, powers your metabolism, shields your heart, and slows the destruction diabetes tries to bring. 3. L-Methylfolate. Vitamin B9, better known as folate in its natural form, and L-methylfolate in its active form, plays a dangerously underestimated role in diabetes care. This one vitamin can quietly affect everything from your blood sugar levels to your nerve function, and most diabetics don't even know they're deficient until severe complications appear. Folate is not just about pregnancy or anemia. It's at the center of DNA synthesis, cell division, and most critically, the regulation of homocysteine, a toxic amino acid that builds up rapidly in diabetics. When homocysteine isn't cleared properly, it silently destroys blood vessels, damages kidneys, triggers nerve pain, and increases your stroke risk by up to 80%. If you're diabetic and not getting enough active folate, you're opening the door to dangerous blood sugar spikes, poor insulin response, and faster organ damage. Research shows that L-methylfolate supplementation improves insulin sensitivity by up to 17% in people with insulin resistance. It does this by reducing oxidative stress inside cells and enhancing glucose uptake in muscle and fat tissues. It also lowers HbA1c by zero point 0.5 to 0.7%, which may seem small, yet in diabetics this reduction is linked to a 21% lower risk of diabetic complications including neuropathy, kidney decline, and vascular disease. What makes B9 even more critical is its impact on blood sugar rhythm. Studies show that fasting blood glucose levels drop by up to 9% when folate is combined with a low glycemic diet. This is due to improved liver enzyme function, reduced cortisol release, and better carbohydrate metabolism. Folate also stabilizes post-meal glucose spikes by reducing endothelial inflammation, making blood vessels more flexible and better able to handle sugar surges. Without it, you may feel constantly fatigued, lightheaded after meals, or experience sharp sugar crashes in the afternoon. The nerve damage side of folate deficiency is where things get frightening. Diabetic patients with low folate often report burning feet, tingling hands, restless legs, and sharp nerve pain that worsens at night. This is because folate is essential for myelin production, the insulation that protects your nerve fibers. It also helps convert neurotransmitters like serotonin, dopamine, and norepinephrine, supporting not just nerve function but also mood, focus, and memory. A 2023 meta-analysis found that folate combined with B12 can reduce diabetic peripheral neuropathy symptoms by up to 30%, especially in older adults. Your kidneys are another major target. Folate supports glomerular function, reduces protein leakage, and protects tiny blood vessels from high sugar damage. Long-term deficiency can lead to microalbuminuria, a silent sign of kidney decline. Folate has also been shown to slow eGFR decline by reducing homocysteine and inflammation, two of the biggest drivers of diabetic kidney disease. The heart is equally affected. Folate helps keep arteries elastic, reduces arterial stiffness, and lowers the risk of stroke by 19% in high-risk diabetics. It enhances vascular nitric oxide, which keeps blood vessels open and responsive. But folate's work doesn't stop there. It improves retinal blood flow, reducing risk for diabetic retinopathy. It protects the liver by supporting methylation and preventing fatty buildup, a key factor in non-alcoholic fatty liver disease, which is common in type 2 diabetics. In the brain, folate improves cognitive clarity, and low levels are linked to early dementia and mood disorders. Even your immune system, hormone regulation, and blood pressure control depend partly on folate's quiet work in the background. Signs of deficiency can easily go unnoticed or be misdiagnosed. These include mouth ulcers, swollen tongue, pale skin, irritability, confusion, headaches, poor concentration, and frequent infections. Some diabetics also report muscle weakness, vision changes, or depression, symptoms often blamed on other causes. In truth, many of these may be early red flags of folate deficiency. In men, a folate deficiency can silently affect sperm quality and testosterone regulation, while in women it can impact hormone balance and menstrual health. Yet very few think to test it early. Let's explore the top 5 richest food sources of natural folate that are diabetic safe and healing. Cooked lentils lead the list with 358 micrograms per cup, providing nearly 90% of your daily need, plus blood sugar balancing fiber. Asparagus, lightly steamed, delivers 268 micrograms per cup and has additional antioxidant properties that support nerve and vascular health. Cooked spinach provides 263 micrograms per cup, along with plant-based iron and chlorophyll that supports red blood cell health. Black-eyed peas offer 210 micrograms per cup, are low glycemic, and support heart and kidney function. Avocados contain 80 micrograms per half fruit, with the added benefit of healthy fats that slow sugar absorption, reduce cravings, and support hormonal balance. Many diabetics, especially older adults or those with gut issues, need supplements because they can't properly convert synthetic folic acid to the active form. This is often due to an MTHFR gene mutation found in up to 40% of people, which blocks that conversion. In such cases, L-Methylfolate is the safest and most effective form. Top supplements include MethylPro L-Methylfolate 1 milligram, which is pure, potent, and designed for maximum absorption. Thorn 5 MTHF 1 milligram, known for high clinical grade quality and great results in people with diabetic nerve damage. And Pure Encapsulations Folate 800 micrograms, gentle on the stomach and suitable for daily long-term use. The recommended daily dose for adults is 400 to 600 micrograms, but for diabetics with deficiency or high homocysteine, therapeutic doses of 800 to 1,000 micrograms daily may be needed for 2 to 3 months under supervision. Going above 1,000 micrograms long-term without checking B12 levels is dangerous. Excess folate can mask a vitamin B12 deficiency, leading to permanent nerve damage. Rare side effects of overdose include nausea, insomnia, bloating, and skin reactions. Folate supplements can also interact with methotrexate, anticonvulsants, and sulfasalazine, requiring caution if you're taking these. Every diabetic should ask, am I missing this quiet protective vitamin? Because without adequate folate, every organ is at risk. Blood vessels become rigid, nerves start burning, kidneys silently decline, and sugar regulation breaks down at the core. You may think you're managing your diabetes well, but if your folate is low, your foundation is already cracked. This is one vitamin that doesn't just support health, it holds everything together. Thanks for sticking with me through this vital guide. If you're serious about managing your diabetes and protecting your body from complications, hit that like button, share your thoughts in the comments, and subscribe for more life-changing insights. Your health is your greatest asset. Don't let misinformation steal it away. Let's keep learning, growing, and beating diabetes together. See you in the next video. Stay strong and stay empowered.